All right, and welcome back in our final conversation for this morning. We have in studio with us Dr. Philip Castillo, who is a trustee on the board of the Public Sector Workers Trust. And we also have Mr. Edward Harris, who is operation manager also at the Public Sector Workers Trust. Good morning, gentlemen.
Good morning. Good morning.
So let's start for those who may not know a bit of the background on the trust and what it is.
It goes back to the period between 1995 and 1997, when government could not pay increments for public officers. And what government did was that government gave the unions shares in BTL. The aim being that the proceeds from these shares, which are dividends, would be used to finance projects for the benefit of public officers.
If you wouldn't mind, what are some of the notable projects, investments that the trust has undertaken over the years?
Well, that's what we're here to discuss.
Good.
Because let's fast forward to 2014, when the trust was actually formed. The trust was formed around 2014 and activated. And we started to develop projects. But as shortly after we were formed, we were approached by claimants because the trust has beneficiaries. Now, some of these beneficiaries wanted money instead of projects. We had discussions with them, and those discussions were ultimately fruitless. And 1 year after, they sued us. So the first lawsuit that the trust faced was in 2015, one year after it was formed. That lawsuit went around till about 2017, if I'm correct, Edward. And the judge at the time, he ordered basically that there be mediation. And mediation happened and was ultimately unsuccessful, and we were sued again. The judgment for the second lawsuit that came out late last year, and basically we see it as a complete victory for the trust. That we are given by the judge 12 months to do projects.
Yeah.
And our first project is a health project, and that's what we are here to discuss.
I'm so glad you set that background because it is a complicated and very long-standing matter. I guess the concern is that when these increments were frozen in the late 90s, those persons, those public servants by now are probably retired. Some have passed on. And the concern is what projects that can be implemented that will have an immediate impact on the beneficiaries.
Well, certainly the health project, meaning that when we did an analysis of our beneficiaries, so increments were frozen in 95, 97, in that era. Let's say on average, let's say you were 30 years old then. So if you were 30 years in 1995, you'll be how old? You'll be about 27 years older than 30 in 2022. So we know that most of our beneficiaries are in their 60s on average. In Belize, the life expectancy is 74. So if you're 60 and you're in Belize, you expect to live until 74. I could tell you that you're facing a range of health challenges. And so our first project is in the area of health. That we know that our beneficiaries are older, and we know that our beneficiaries are facing a range of health challenges, and we're hoping that this project goes somewhere towards addressing those challenges.
How many of the beneficiaries are retired?
Have that number, Edward?
On estimate.
We don't have that specific
I would think
number.
about half, possibly.
Yeah.
What about half or more?
Possibly.
Because that's also a key matter. 27, how do you, is there a measure in terms of what each beneficiary would be due to the increment freeze? If I was closer to retirement age, I was earning more, my increment freeze perhaps cost me more than a junior officer who's coming up the ranks.
Well, the reason why we're not focusing on that is that the judgment specifically said, in fact, both judgments said, that the trust funds are not for individual distribution. So we have not gone the way of calculating how much each person would have gotten. Because it's specifically not for individual distribution. It's for collective projects.
Now, I know I know that you're very clearly seeing that the judgment is out, but while the judgment is one thing, all the beneficiaries are watching thinking, why is this the case? So how do you come up with the project, and who agrees that the project is the best for the beneficiaries?
There were initial consultations. We did countrywide tours. We got feedback from beneficiaries in every single district town. In fact, we did Belize City twice. And that came up basically.
Yeah.
That people want, because health, focusing on health, of all your expenditures, health is the single most expenditure that is most unpredictable. Yeah. In your own life, you have, you pay utilities, you pay food and those kind of things. But focus on health. Health is by far your most unpredictable expenditure. Ideally, you want to have insurance. In fact, to give the claimants credit, I think that was one project they suggested. Yeah. Insurance. The challenge we faced was that insurance companies were unwilling to insure a large amount of fairly older people. Yeah. So next we're focusing on health then. What is your state of health? And if you know your state of health, listen, it's an advantage to know where you are with your state of health and what possibly can be done.
All right, so let's talk about the rollout of the health project. That's the first step?
That is the first step. Yes.
Getting your health assessment.
Yeah, well, you could see, we call it a 5-step process. So the first step is that we've published the list of beneficiaries on our website. Government is the settlor. In terms of a trust, the settlor is the owner of a trust. So government gave us a list. The government has itself indicated that the list is incomplete. But then we have a list and we're
The list is incomplete.
Government said that, yes. But we have a list and we are starting with that list, and there's a procedure to add yourself to the list if you feel like you're a beneficiary but you're not on the list. So the first step then is that you visit our website to see if your name is on the list. Now,
and if your name is not on the list,
I will explain what happens then.
Okay.
But having ascertained that your name is on the list, you phone, step 2 is that you phone the offices of the trust to set up an appointment to go to the trust. Step 3 is that when you're at the trust, we give you a form. Now with this form, you visit the medical provider of your choice. We're focusing initially on 2 medical providers, the Belize Healthcare Partners. We have a signed contract with them. And the Belize Medical Associates, we expect to finalize a contract with them this week. Now, these are among the 2 best medical providers in this country.
Okay.
You go to these providers, and there's a range of tests that you take. Possibly Edward could explain those tests. Yeah. And then step 4 after that is that there's a medical consultation, meaning that when you take certain tests, these machines spit out results. You as a lay person may not understand these results. You need to consult with a medical provider to explain these results. So then, at the end of that process, given the range of tests that you will undertake and the consultation, you, the beneficiary, you should leave that medical facility, or you should leave that consultation with a very good idea of the state of your health.
And that's the project.
That is the project.
So you're paying for an annual checkup?
Basically.
Okay.
Yeah.
And from the beneficiaries, when you consulted, they said that this was something they couldn't afford or didn't have access to before?
Well, we know that most beneficiaries focused on health.
Okay.
In fact, what we're focusing on is possibly secondary treatments, basically.
But you want the first data to know?
Yeah. But if you focus on curative health, like tertiary health care, it's extremely expensive. Meaning that if a test is done on you and it's found that you have whatever you have, the treatment is extremely expensive. So we are not there yet. We just want to focus on their state of health, what they have.
So what are the tests that you can take?
The test is a series of laboratory testing which includes blood storing and use such as triglycerides, cholesterol, BUN, which is blood urea nitrogen, pap smear for females, prostate-specific antigen for males. About 9 or 10 of those different tests, as well as a physical breast examination you have for females for cancer screening as well. And then you have physical measurements such as BMI, heart rate, blood pressure, and those sort of things.
What is the trust worth at this point?
The total value of the trust is over $9 million, but we have $8 million in cash, and the remainder is in actual like shares.
And the members, list of beneficiaries, what's the amount?
It's around 10,000, we think.
Okay. How do you ensure the sustainability of the trust as you continue to invest in project that requires these types of expenses?
Well, it's a very good question, because if you have $8 million in a bag or in a barrel, and all you're doing is taking out from that barrel, it will eventually finish. So then a challenge facing the trust is that as we spend money, we have to find ways of generating more money to put back in the barrel. The challenge you're facing in Belize is that there are extremely limited investment options. We are here to answer your questions, but if you could ask you a question, if you have $8 million, how could you not spend it but invest it? What are your options?
Well, that's why you are the mutually agreed trustee to be able to consult and to explore options. But I want to come back to it though. As we noted, because this is 27 years later, there are some beneficiaries who perhaps are no longer
With us.
alive. Will their survivors be able to benefit from the trust because they have also contributed towards the trust?
That's a very good question, and initial discussions have begun in that regard. We want to give a lump sum. We are not certain of the quantity yet, of the quantum, but yes, that's what we're thinking from the date of the judgment.
Do you know how many persons have passed?
No, we have no idea at this point.
Oh, wow. Yeah. Now, the checkup is kind of the first phase, as you outlined. It's looking at your blood profile, your cancer screenings, seeing your overall health status. But it ends there. So if I get a cancer diagnosis, it's not that you will continue to pay for my care.
But two reasons why we can't. Resource constraints and equity. Let's focus on resource constraints first. We acknowledge that our beneficiaries are an older age cohort.
Yes.
And I said earlier that health is one of your most unpredictable expenditure. If, for example, it's found that you have cancer, really, the treatment for cancer can be extremely expensive, and then cancer could be a lifetime ailment.
Yeah.
So the trust does not have $8 million, cannot finance tertiary care for 10,000 persons. It just can't. So those are resource constraints. And then the next issue is equity. If you focus on tertiary care, we are starting in Belize City, but we have beneficiaries countrywide from Punta Gorda, Dangriga, Corozal. So if we spend all the money in Belize City, what about the person in PG? That's certainly not equitable.
And that was going to be my next question. How does someone from PG who is a beneficiary then access a checkup in Belize City? That's an additional cost associated with travel.
Yeah, but we are starting in Belize City. And then we expect, we anticipate a phased rollout to the other districts.
Okay.
Now you mentioned PG, and we are fully aware what we want to do at the end of the day. We want that every single beneficiary who accesses the trust get the same level of health care.
Yeah.
Now that's a challenge because the facilities in Punta Gorda may be different from the facilities in Belize City. So obviously what we'll have to do, the options facing us, is to discuss with these medical providers anyway how they can reach PG. That's one option. The next option is to find out how possibly persons from PG could come to Belize City.
Yeah.
So we are still at that, but then we're focusing on Belize City and see how it goes in Belize City before we, Belize District, sorry, before we expand.
Is there a time frame that you're hoping that people will go out and do their health test?
Yeah, starting today.
Starting today, yeah.
Yes. Well, because we are
You
launching
get
now.
the form, you fill it out, and
Yeah.
then I go back to you, or I go directly
No,
to
you
the
go
hospital?
directly to the facility. And the reason why the form is important is that it provides a paper trail. The trust is audited. The trust has always been audited, and we publish our audits. If there's a clear paper trail, obviously the auditor can follow the paper trail
Yeah.
and see where the money is spent.
How much do you expect to spend on this one project, this first project?
Well, if we anticipate around 10,000 beneficiaries, more or less, and we're spending 200 per beneficiary, you're looking at $2 million. But there are other costs.
And that's if everybody gets the health
Yes,
test.
if everybody,
Yeah.
yes, yes.
Because there may be persons that are already in need of tertiary care that has already done
The checkup.
certain tests and certain checkups and don't necessarily need this this type of test, which goes back perhaps to the question of whether a survey was conducted just to really see how much of your beneficiaries need this
Yeah.
type of
Yeah.
service.
Again, it's a valid question. But again, one of the things we did to raise money, Marlene, you raised that earlier, is that we had a variable loan scheme whereby we loaned money at 5% interest. Now focus on that. Our beneficiaries included pensioners. And we know that some pensioners in this country, their pensions were about $300-400 a month. With that level of pension, no bank is going to lend you money. No credit union is going to lend you money. They borrowed money from the trust and paid back.
Okay.
Well, the first judgment, this loan scheme, there's an injunction against the loan scheme, and that injunction remains. So obviously, we have to find ways of lifting that injunction so that we have the wherewithal to lend to these persons at extremely low rates.
So what is the next phase of this plan? You roll out today the health project, which means any person who is a beneficiary of the Public Sector Workers Trust, who is listed as a beneficiary or can prove they're a beneficiary,
That is correct.
they can go get a form from your office and go for a full checkup to understand the health status.
That is correct.
That's phase one, right?
Yeah.
What's the plan after that?
Well, we are starting in the Belize district.
Okay.
Obviously, phase 2 would be to expand to the other district towns. So that is the health project. So we want to see how that goes. Now, the other project we have in the pipeline focuses on sustainable livelihoods.
Yeah.
Again, our beneficiaries are an older cohort. We want to partner with the Ministry of Agriculture, that if we could provide you with implements and utensils and whatever you need to grow food at home, because you don't need a backyard to grow food at home. You need a tire and those kind of things. And so that provides, it adds basically, it could reduce your food bill. It provides a healthier way of living because you're working, you're walking, you're growing what you plant.
Well, I mean, that depends on health status too, because
Yeah.
if you're arthritic and have to kneel down or dig, that's
Yeah.
kind of hard.
Well, true enough. But then, so that we anticipate that that's our second project.
Okay.
Now, the judgment recognized that there is absolutely no project that can equally benefit all beneficiaries. But then we're open to suggestions from beneficiaries on what project they would want, collectively, basically.
What's the age range? Do you have data on that?
Well, the average age is around 60, but we know that the youngest beneficiary would be in their late 50s, and then the oldest would be 90s, thereabouts.
What does that say for the future? Final question. Say for the future of the trust over the next decade or two.
Well, by law, the trust is expected to last, I think, 50 years. Yeah, 50
Okay.
years. But because some beneficiaries are in their 50s, well, it goes on to about 50 years from now.
Yeah. All right. So where do people get more information if they want to access the health project?
You can get information from our office. Our office is located at number 5620 Main Avenue, corner when Lizaraga and Main Avenue.
Okay.
Also, we have a Facebook page, which is Public Sector Workers Trust. They can also message our WhatsApp at 673-7798 or call our phone numbers at 7799 or 223-2877, and we'll be able to answer any questions they may have.
All right.
Well, with that, gentlemen, we want to thank you for both your time being with us on the show this morning to discuss this very important topic. With that, we'll take our final break, and when we come up, we will wrap up this Monday morning show for you.